Good. Okay, so we'll get started then. I think some folks are still joining, but we'd like to get started. So thank you for joining today's webinar. This is an introduction to the Journey to Perinatal Well-Being and suite of provincial practice support tools designed to assist public health nurses in addressing perinatal depression and anxiety. I want to say thank you to our partner, BC Council for Families, for hosting us today and supporting us with this webinar. My name is Sarah Amiot. I'm a policy analyst at the Ministry of Health with a focus in maternal and women's health. I'll be facilitating this webinar for us today, and I'm joined by my colleague Carolyn Solomon, the Manager of Maternal and Women's Health at the Ministry of Health, and she is the project lead for this project, and she'll be our main presenter today. Now that we've gotten our audio issues worked out, we just want to send a couple of reminders, a couple housekeeping reminders today. Sorry. So when listening to the webinar, if you could just attempt to use a high-speed internet connection, it provides you the best connection. Use a headset or earphones, and I think that we'll be muting the callers so that we don't get feedback from you. If you have a microphone on your phone, please do mute it. And just a note about questions for the webinar. So we're going to hold all the questions till the end of the webinar, but you can type your questions into the chat box at any time, and I'll be collecting them, and then I'll read them back to Carolyn and to myself at the end of the webinar to respond to. We also want to let you know that the notes from the webinar will be emailed out to all registrants after, and that this will include the recording, a link to the recording of today's webinar. So to note, we are recording the webinar today. We haven't started yet, and before we start recording, we wanted to kick it off with a quick pop quiz. So you can provide your answers in the chat box. I'll just show you where that is. So you can type your responses to the questions in the little chat box that you should see on the right-hand side of your window. Oh, and you're all answering the question already. So who may experience perinatal depression and anxiety? Biological fathers, biological mothers, adoptive parents, non-custodial parents, same-sex parents, or F, all of the above. And already I've seen from many of you F. So the answer is F, all of the above. And in the course, we cover the risk factors associated with perinatal depression and anxiety for diverse population groups, as well as the protective factors for these groups. We also discuss how to work with women and families to build resilience and to lessen the impact of perinatal depression and anxiety. So that's great. I'm glad to see that you all are well versed on the topic already and that we are successfully using our chat box. At this point, we'll begin recording of the webinar, and I will turn it over to Carolyn Solomon.
Hello all, my name is Carolyn Solomon. I'm the Manager of Maternal and Women's Health here at the Ministry of Health. So welcome to the orientation webinar for Journey to Perinatal Well-Being, an online practice support resource to increase your knowledge and skill to support the early identification, treatment, and responsive follow-up of women and families experiencing perinatal depression and anxiety. I'm sure most of you are familiar with the adverse outcomes associated with perinatal depression and anxiety. It's a serious health issue that impacts not only women, but also children and their families. In fact, depression is one of the most common health issues that women experience, and postpartum depression is the most common complication after childbirth. Perinatal depression and anxiety is associated with reduced use of maternal health care, lower breastfeeding rates, and alcohol and tobacco use. Perinatal depression and anxiety are also characterized by feelings such as body responses, somatic changes that can reduce the quality of life, such as fatigue, changes in appetite, withdrawing from friends and family. And then for infants and children, untreated perinatal depression and anxiety can adversely impact the cognitive, behavioral, and emotional development through compromised parenting interactions and exposure to stressful home environments. Women with perinatal depression and anxiety are less likely to engage in health promotion activities for the infant, such as breastfeeding, completing immunizations, engaging in safe sleep practices, using car seats, and home safety practices. Further, perinatal depression has been associated with an increased risk of depression in fathers. So the development of Journey to Perinatal Well-Being, the online course and practice support resources, was a collaborative effort with BC Reproductive Mental Health Program at PHSA, all health authorities, BC Council for Families, Child Health BC, and other key provincial stakeholders such as the Pacific Postpartum Support Society. The goal of the project is to improve supports for women and families experiencing perinatal depression and anxiety. The impetus for this project was to support the advancement of the Healthy Start Provincial Perinatal Child and Family Service Standard for perinatal depression on a provincial level, so that regardless of where a family lives in the province, they have access to consistent public health support services to support optimal health outcomes. This initiative was informed by the results of a needs assessment that was conducted with public health nurses and administrators across the province. The purpose of the assessment was to identify their practice support needs in order to provide effective and responsive public health services for women and families with perinatal depression and anxiety. This project represents a continued commitment from the Ministry of Health to support women and families with perinatal depression and anxiety on a population level. As you know, perinatal depression and anxiety is an important health concern that impacts as many as 1 in 5 women and families across the province. This project aligns with and advances provincial strategic policy direction, including addressing perinatal depression, a framework for BC's health authorities, the Healthy Families BC policy framework, and the Healthy Start Provincial Perinatal Child and Family Public Health Perinatal Depression Service Standard, among others. The goal of this project is to build the required knowledge, skills, and confidence of public health nurses to support the early identification, treatment, and responsive follow-up for women and families experiencing perinatal depression and/or anxiety. The objectives of the project are to standardize public health nursing knowledge across all 4 pillars of addressing perinatal depression, a framework for BC's health authorities, including family and parent-child mental health, and to clarify the roles and responsibilities of public health nurses in providing support for perinatal depression and anxiety, and to assist public health nurses in promoting positive mental health with families to prevent perinatal depression and anxiety, including relapse. The foundational best practice documents that have informed the development of the online resources include, as I've mentioned, Addressing Perinatal Depression, a framework for BC's health authorities, the Cognitive Behavioral Therapy Guides developed by BC Reproductive Mental Health at PHSA. So those include Coping with Anxiety during pregnancy and following birth, and Coping with Depression during pregnancy and following birth. Best practice guidelines for mental health disorders in the perinatal period developed by BC Reproductive Mental Health Program and Perinatal Services BC at PHSA. The Growing Together Toolkit developed by BC Council for Families called Growing Together, Supporting the Mental Health and Wellness of Young Children, Mothers and Their Families, and other resources such as Celebrating the Circle of Life. Key components of these best practice resources that are relevant to public health nursing practice have been included in the course. Links to all of these resources are included in the resource section of the course. Although public health nurses are the target audience for the online course and the resources, much of the content may be of benefit to other provider groups working with perinatal women. Midwives, nurse practitioners, social workers, psychologists, and even paraprofessionals and lay support, such as pregnancy outreach program staff, may benefit from taking the course. So to access the course, navigate to the Provincial Health Services Authority Learning Hub. If this is your first time taking a course on the Learning Hub, you will need to create an account. This will allow you access to this course at no cost and many other courses offered for healthcare providers on the site. Once you have created an account, you can register for the course. Should you have difficulty creating or accessing your Learning Hub account or other issues, contact the Help Desk at the Learning Hub. The contact information for the Help Desk is listed on the registration page. Once you have an account with the Learning Hub, sign into your account and navigate to the course by conducting a search using the Find a Course button located on the upper left-hand corner of the screen. Search for Journey to Perinatal Well-Being, click on the title of the course, select Register, and then click on Start Course. So it should be pretty intuitive to access the course. The next screen is the landing page for the course. You will see that there's an additional option for graded tests. At this time, select the Journey to Perinatal Well-Being option. You will need to return to this page later to complete the final test to be eligible to receive your certificate of completion and to complete the course evaluation. The estimated time for completion of the course is 2.5 to 3 hours. The course is organized into 4 modules. All activities on each slide need to be completed sequentially in order to progress to the next slide. However, you do not need to complete the course in one sitting. You can exit at any time, and your place in the course will be saved until you are ready to resume your learning. This allows you to learn at your own pace. The course contains an introduction and 4 lesson modules. The modules mirror the 4 pillars of the perinatal depression framework. These are education and prevention, screening and assessment, treatment and self-management, and coping and support. The navigation menu is located at the top left-hand corner of the screen. Navigation instructions are provided throughout the course through a series of pop-up windows and prompts in the course introduction. The menu bar allows you to easily return to specific course content to refresh your knowledge. Click on the menu to display the lessons. You'll also note that the top navigation menu includes a glossary section and additional resources. You can access these sections at any time or even after you've completed the course. To begin the course, use the previous and next buttons at the lower right-hand corner. Use these buttons to navigate the course. In order to progress, you will need to complete each activity on a slide. Once you have completed an activity, you can return to it at any time using the menu bar. The introductory module provides an overview of the thematic sections covered in each module of the course. The modules contain 6 sections: test your knowledge, learning objectives, lessons and subjects, bringing it to life, strengthen your practice, review, and summary. Test your knowledge questions are review questions designed to reinforce your learning from the previous module. Learning objectives outline the knowledge, skills, and approaches that the learner will be presented with in the module. Lessons and subjects outline key concepts, evidence-informed information, and important resources regarding the public health nursing role in addressing perinatal depression and anxiety. The Bringing It to Life component is comprised of video vignettes designed to help the learner apply the theory and content from the module into practice. The Strengthen Your Practice section is an opportunity to reflect on, identify, and share ideas to further develop your practice, and provides an at-a-glance summary of the role of the public health nurse in the context of each specific module. The Review and Summary component is an opportunity to review what you've learned. These practice questions are not graded. Once the learner has completed the entire course, they will be prompted to complete a final test that is graded. Once the learner has completed all of the course content, They will return to the course landing page and select Graded Test to access the final test. A grade of 75% completion is required to pass and receive a certificate of completion. Regular reports about users who have completed the course will be provided to health authorities to help monitor the progress of course completion by PHNs in each region and to support program planning. The introductory modules outline the overarching learning objectives for the course. This module also outlines the approaches to care or foundational approaches that underlie the course, including relational practice, woman and family-centered care, trauma-informed practice, and culturally safe care. These approaches guide all public health nursing interactions with women and families and emphasize the client as the expert of their own lives and their own unique experiences. Module 1 focuses on education and prevention and aligns with the health promotion and education interventions that public health nurses offer women and families. The content in this module focuses on the latest research and evidence-informed practices in the area of perinatal depression and anxiety. The module explores the prevalence, signs and symptoms, and risk and protective factors for perinatal depression and anxiety, and includes a specific lesson on the impact of breastfeeding on depressive symptoms. This module also discusses strategies that public health nurses can use to help mitigate stigma associated with perinatal mental health concerns. The current slide provides an example of an interactive infographic featured in the course to engage learners in the content. Let's take a brief pause to test your knowledge again on the prevalence of perinatal depression and anxiety. Please type your answers into the chat box. So the first question is, what percentage of women will experience a major depressive episode during pregnancy? So again, what percentage of women will experience a major depressive episode during pregnancy? I'll just give a moment for folks to respond. Great. Most of you are in the range of the prevalence of perinatal depression. Up to 16% of women will experience a major depressive episode during pregnancy. In the postpartum period, prevalence rates have been cited between 9 and 31%. So as you can see, depression can be just as common during pregnancy as in the postpartum period. Okay, the second question. What percentage of women will experience an anxiety disorder during pregnancy? So again, what percentage of women will experience an anxiety disorder during pregnancy? Great, and again, we have a very well-informed audience. So the answer is about up to 8% of women will experience an anxiety disorder during pregnancy. This prevalence rate is very similar for the postpartum period as well. So this really demonstrates that you have a good grasp on the prevalence of perinatal depression and anxiety. So let's move on to discuss Module 2. So Module 2, Screening and Assessment, focuses on orienting the learner to best practices and skills for effective screening and psychosocial assessment for perinatal depression and anxiety. The module provides an overview on using motivational interviewing and screening and assessment, how to screen using the Edinburgh Postnatal Depression Scale, the EPDS, and tools to support the identification of perinatal anxiety. This module also includes a lesson specifically on the interpretation of EPDS scores, the appropriate action to take, and the expected intensity of the intervention, as well as a lesson and supporting video on responding to risk of suicide and safety planning. Module 3, Treatment and Self-Management, reviews the role of public health in working with clients to develop a treatment plan with women experiencing perinatal depression and anxiety, and including supporting self-management strategies. This module provides public health nurse with key information on treatment options, such as cognitive behavioral therapy, talking therapies and medications, and builds knowledge and skills to support relapse prevention. This module also includes activities and ways for public health nurses to talk about the NEST-S health promotion model, that is nutrition, exercise, sleep, time for self, and support. It also covers self-management strategies based on cognitive behavioral therapy. Module 4, Coping and Support, is focused on providing public health nurses with the knowledge and skills to work with women and families experiencing perinatal depression and anxiety to build a circle of support around them. There's also a specific focus on supporting women with co-occurring substance use concerns. This module includes content designed to help engage a woman's family in her recovery and provides information for public health nurses about key resources that are available to support women and families across the province. This module is a resource that public health nurses may want to return to for reference and can access at any time. In addition to the content of each of these modules, the course also contains an additional resources section with tabs for resources for health professionals and those for women and families. This section of the course includes a downloadable version of the Strengthen Your Practice content that summarizes the key messages and interventions that are part of the public health nursing role related to each of the pillars. At this point in the webinar, we will turn our attention to providing an overview of 3 additional resources that have been developed as part of this project. The first item that we will introduce is a series of short videos that have been integrated into the online course. The first one is a welcome message, and there are also 3 case study vignette videos. Firstly, these videos highlight the importance of the public health nurse as an integral provider in the perinatal service delivery continuum to support the early identification and responsive follow-up for women and families experiencing perinatal depression and anxiety. Secondly, the videos provide a chronological representation of typical public health nursing interaction in working with a client through the recovery process. And finally, the video models approaches to care, for example, motivational interviewing. Video 1 covers a public health nurse offering health promotion education. Video 2 models a public health nurse working with a client at risk of suicide to develop a safety plan. And Video 3 demonstrates completion of public health nurse follow-up, that is, wrapping up engagement with the client and demonstrating the importance of support for the client's recovery. At this point, we'll show you a short snippet from one of the videos. This one addresses safety planning with the client presenting with suicidal ideation.
The EPDS is a screening tool that we administer to women universally in British Columbia. It's a way of screening for the possibility that a client might have postpartum depression. It's a 10-question screening test, and the last question we're addressing the potential for any harm to be done to the client herself or to the baby.
Looking at your responses, it looks like you may be at risk for depression. How does that make you feel?
I knew that I wasn't, feeling very well. And the questions were pretty scary, especially the last one. Answering sometimes was pretty hard to do.
The last question on the 10-question screening tool addresses safety, the potential for suicide, thoughts of suicide. When having difficult discussions with clients who may have scored positively on the last question, then we want to have an immediate discussion with the client and consult with the primary care provider, help them form strategies for themselves, psychotherapy, cognitive behavioral therapy. We can really just help them navigate the system. It's very important to observe for nonverbal cues as well as listen to what the client is saying, because oftentimes there can be a disconnect between the two. So it's important to be sensitive to those things as well as what the client is saying.
Would you feel comfortable talking more about that?
I mean, I never really thought about myself as someone that would want to harm myself. But sometimes, honestly, I think about it, because I feel really alone, and my husband, he's out of town all the time, and I just don't have any control.
You're very brave in sharing these feelings. Tell me, have you ever thought of a plan to harm yourself?
No, I mean, I was a little bit depressed after a miscarriage, and I was on medication, but nothing like this.
Thank you for your honesty. Having thoughts of harming oneself is an important issue to address, and I know these thoughts can feel scary. But there are treatments and support available that can really help. Starting now can help reduce the length and the severity of these feelings. The first step is sharing this information with your family doctor so we can work together to get you the care you need. I would also recommend a referral to a mental health clinician who specializes in ways to improve depression symptoms. Would you be open to connecting with these care providers?
Early identification of perinatal depression is key in identifying clients who could benefit from early intervention and treatments that are available. If these are implemented early, they can help to decrease the severity and reduce how long the perinatal depression lasts and the impact on the woman and her family.
Yeah, I mean, I don't really want to feel like this, and I want to be there for my baby.
Sounds like you want to do what's best for you and your baby. Can we work together on a plan to help keep you and your family safe?
A safety plan can be developed with the client and a responsible family member when there's an identified risk of suicide. The safety plan involves 4 parts. The first part is identifying warning signs that are specific to that client. Feelings of hopelessness, helplessness, and involve actions like talking a lot about death, hoarding medications, things like that. The second part of the safety plan would be identifying some coping strategies that would work for her to help to reduce the risk, going for a walk or meditating. And the third part of the plan is identifying a support network, people that the client can rely on when they are in need. It's important to identify in a safety plan professional and community agencies, the crisis line, the hospital emergency room, anything that is a lifeline for that client.
Okay, so let's go over the 4 pieces of the plan.
Okay, so the warning signs are if I feel hopeless or like a failure or unable to cope. And coping strategies are deep breathing. I can call my husband. I have my family and my in-laws and my friends if I need help. And if I really need, I can call my doctor, the crisis line, or 911.
Public health nurses are able to address concerns one-on-one with clients and really form a rapport with clients. So it's important to follow up with the client because things can change over time.
I'd like to follow up with you in a couple of days to see how you're doing and to see how your doctor's appointment went. Would that work for you?
So we hope you found that video to be a meaningful and helpful interaction between a public health nurse and a client who indicated a positive response on question 10 of the EPDF. So additional practice support materials have been developed as part of this project, and they include a facilitator guide and case studies to support facilitated learning sessions. These have been designed to support knowledge coordinators, clinical nurse specialists, or others to deliver group learning sessions that can occur after learners have completed the online course. These sessions can be held in person or remotely and serve to integrate the course learnings into practice. The sessions are intended to be customized to support local learning needs. The case studies have been developed by subject matter experts and are meant to create an opportunity to apply and practice core concepts, skills, and approaches from the course. They allow learners to engage with practical scenarios to discuss complex case management and model responses, and also to create an opportunity for the learners to deepen and apply their knowledge of local and provincial resources and referral processes. The final resource available is the Public Health Perinatal Depression and Anxiety Quick Reference Guide. This is a 4-page graphic document for use by public health nurses in daily practice. The Quick Reference Guide is customizable by health authorities and contains information on a number of key content areas from the course. This document provides key messages and learnings from the course at a glance and in an accessible, easy-to-digest format. This includes a table summarizing EPDS screening scores and the corresponding actions to take in response to support women and families. Also featured are sample questions and conversation starters with public health nurses that they can use in interacting with clients. Finally, the Quick Reference Guide provides a helpful reminder of the self-care resources outlined during the course, including the NestS Health Promotion Model. At this point, we would like to pause and acknowledge the valuable contributions of the partners in this project. This project has been developed in collaboration with BC Reproductive Mental Health Program at PHSA, BC Council for Families, Pacific Postpartum Support Society, Child Health BC, and all health authorities in BC. Together, these organizations participated in numerous working group and steering committee meetings, supported content development, and provided a detailed review of all of the material. This project would have not been possible without the significant collaboration and involvement of these partners. And I would like to extend my sincere thanks to all of you in support of this important project to improve outcomes for women and families across the province. So the course and resources were made available to health authority partners in August of this year. Health authorities are currently communicating internally about the course and working on their implementation plans to have PHN complete the course over the coming months, according to internal needs and as resources allow. An emailed announcement of the course will contain registration instructions that will be circulated this week. You can use this announcement to promote the course to your team. And finally, the ministry and partners are committed to sharing information about these resources and are currently engaging stakeholders in this process. We would appreciate your feedback on other engagement opportunities. And also, if there's a need, the ministry will consider developing similar practice support resources for other healthcare audiences, for example, physicians, to encourage a consistent approach to supporting women and families with perinatal depression and anxiety. So we would appreciate your input on this as well. So thank you for listening to this webinar on the introduction to the journey to perinatal well-being and the provincial Public Health Perinatal Depression and Anxiety Practice Suite of Practice Support Tools. During the webinar, you've been submitting your questions via the chat function. If you have additional questions, please feel free to submit them via the chat dialog now. My colleague, Sarah Amiot, has been collecting them and she'll share them with us for discussion. Since this webinar is being recorded, out of respect for the privacy of the participants, we will not be sharing the names of the individuals providing questions or feedback during this segment. So thank you.
Thank you, Carolyn, and thank you, everyone. So if you would like to submit a question, you can submit it to everyone or to me privately as the presenter, to Carolyn privately as a presenter, and I'll share them with the webinar. So we do have a question here. Would this course apply to maternal child health teams?
Yes, and in fact, that's the target audience, is to really support public health nurses or other providers that work with you as part of the maternal child health teams to provide responsive services, which includes early identification, so screening using the EPDS tool, psychosocial assessment, so really to build practice in that area to support identification in families, acknowledging from our very first introductory pop quiz that there are a diverse population group that can be impacted by perinatal depression and anxiety. Those health promotion and education interventions that public health nurses provide, and then also about working across that perinatal service delivery continuum and working with other provider groups to provide really that wraparound support for clients and supporting self-management strategies, working with clients around brief action planning. So any public health nurse that works with women and families, whether it's in the prenatal period or in the postnatal period, it could even be a benefit to those nurses that currently support the Nurse Family Partnership Program, really to strengthen skills and expertise to provide responsive services for women and families experiencing perinatal depression and anxiety.
So Carolyn, could you tell us a little bit about how health authorities can customize the quick reference guide to their local needs?
Mm-hmm. So on the last page of the quick reference guide, you'll note that there's a section for local resources. We certainly have some very good provincial resources in the province, but also acknowledge that there may be some local resources that public health nurses may like to have at their fingertips as part of the quick reference guide. So there's some lines that are left for health authorities to fill in those sections if there are local resources that they'd like to highlight, either for the public health nurse or resources that are applicable to women and families.
Great. In advance of the webinar, I also received a couple questions. So one person was asking, how can I access support or get answers to some of my questions about the course?
So there's a number of layers of support for the course. For questions about the subject matter, so if it's a practice support question that is in the local public health nursing context, the first line of contact would be the team lead, the clinical nurse specialist, the manager, depending on how your structure is organized for public health nurses to ask those practice support questions. It could be their supervisor, someone in their health authority if it's more of a practice support type of question. If there's questions about the course content or feedback about the course, you can access the course manager. This will be listed on the course homepage in the Learning Hub. And then if there are technical questions that require more help desk type of support, you can contact the Learning Hub help desk, and the Learning Hub can also work with your local help desk if it's a local technical issue that you're experiencing.
So we also had a question about the potential for a physician targeted course, and if there's definite plans to proceed with that, or if that's an idea under consideration.
Yeah, so we are engaging with the University of British Columbia Continuing Professional Development team to determine if we can proceed with working with them and developing a course for physicians that would include CMEs to really encourage an incentive for physicians to take the course, you know, acknowledging that it really requires that interdisciplinary support and a consistent approach to supporting women and families. And so I see physician audience as being really critical in working with public health to provide that coordinated wraparound support for families. So certainly ongoing discussions are taking place, and we'll be updating you as we move forward.
Thank you. We've also had a question about sharing the course with our partners at First Nations Health Authority and community band nurses. So will this be shared with the First Nations Health Authority, and can it be accessed by community band nurses?
Yes, most definitely. Community health nurses are definitely considered a target audience for this course as well. So it's all of those providers in community settings, and primary care providers as well can take the course. So I see this course being applicable to a really diverse audience, and we know that often families residing in First Nations communities may deliver in more urban settings, and then there's a shared care or a transition of care from public health to the community health nurse. So really important for both provider groups to have that sort of consistent foundational knowledge in supporting women and families with perinatal depression and anxiety. And we'll be working very closely with Barb Webster as well as Kayla Serrato in terms of supporting the implementation for First Nations Health Authority. So an excellent question, thank you.
Great. We have a question here about how can learners provide feedback on the course?
So at the end of the course, there's a short course evaluation, and this feedback is really important as we move forward and help us to improve the course. We're also in the process of developing an evaluation plan, and we'll be conducting one or more focus groups with public health nurses to really get that feedback from those who are providing the direct services. But that being said, at any point in time, any public health nurse, nurse manager, clinical nurse specialist, team lead across the province can submit their course feedback via accessing the course manager on the Learning Hub. And we really encourage and welcome your feedback so that we can continue to strengthen the resource going forward. So whether it's the online course, the quick reference tool, the Strengthen Your Practice, the facilitator guide, case studies, I envision in the future that, you know, to continue to build the knowledge and expertise of public health nurses, that we would continue to work on developing case studies to support more complex case management. As it's being rolled out in health authorities, practice questions are going to arise, and we'd be very interested in those practice questions and how we can bolster course content in order to best address those learning needs.
Great. So we have a question here about the availability of mental health resources across the province, and how this course can contribute to ensuring that there's adequate resources in place.
So we know that the response isn't just solely the responsibility of the public health nurse, that there are other provincial resources that also support women and families. I think the first piece is about adequately using our resources and leveraging our resources. So for example, at BC Reproductive Mental Health, there's a psychiatrist on call who's available to take questions about perinatal depression and anxiety. We have the Pacific Postpartum Support Society. Many of the women that work with PPPSS have a lived experience of perinatal depression and anxiety. There are a number of support groups across the province. And so I think it's really important to be able to work effectively across the continuum of care and really leverage the resources that we have in this province and use them to the best effect. And also the intent of this course as well is to have a preventive aspect. So I talked about the Nest-S health promotion model and how you can use that model in working with all families, not just those that are experiencing perinatal depression and anxiety, but also build the resiliency of women and families to prevent perinatal depression and anxiety as well as lessen the impact. And we know that perinatal depression and anxiety can have a chronic nature if it's not treated effectively. And that's when the most serious outcomes occur, is when perinatal depression and anxiety, when there are repeated episodes of a chronic nature. So public health nursing function in terms of those health promotion and preventive services, I think, play a really critical aspect in decreasing the burden on the health of the population when it comes to perinatal depression and anxiety.
Thank you. So we also have a question about if the course will be shared with midwives.
Yes, that's a very good question. I think also midwives also play a key role. And as all of you know, work really intensively with families, particularly throughout pregnancy. And as we mentioned earlier, the prevalence in pregnancy is also quite high, and in the initial postpartum period, and really helps to support that transition of care as well from from midwifery to public health nurses and support a consistent approach. So we'll also be encouraging, midwives, nurse practitioners, and other provider groups who work with women, perinatal women. I also see this content as being applicable to pregnancy outreach program workers or social workers, and enhancing their skills and knowledge in this area.
Great. So just a couple more questions. Can you just tell us a bit about the timeline for public health nurses to complete the course?
So the timeline for completion is really dependent on health authority implementation plans. So I know that health authorities are in the process right now of sort of validating or determining, what those timelines are going to be. Some health authorities are working it into their overall orientation plans for the year. There's some competing priorities coming up in the early fall, but we anticipate that the course will be implemented over this fiscal year, depending on local needs and resources and orientation approaches. Some health authorities will be also conducting the face-to-face or remotely delivered orientation sessions that are more advanced learning sessions, as I spoke to earlier. So using that facilitator guide to guide participants through case studies to help integrate those course learnings into local practice. So what does this actually mean for practice at the local level? What are the support services that are available? And how also can we build more of a mentorship model within public health nursing so that more senior nurses who are perhaps more comfortable with working with families with perinatal depression and anxiety can mentor other nurses and really work together as a team in terms of how you provide support resources for women and families with perinatal depression and anxiety in the local context.
Great. Thank you. Another question just came in here. So is the facilitator guide ready for us to use?
Yes, the facilitator guide is ready. And I just wanted to speak a little bit to the approach to the facilitator guide. We've developed case studies, as I've mentioned, and the case studies, as the sessions evolve, there's more information that's provided to build on the case and flesh it out in more detail, and the public health nursing response, working with the woman and family through the initial, assessment, screening, motivational interviewing techniques, brief action planning, so really to provide that responsive follow-up. And so just a few details about the case scenario will be provided to those participants in advance of the facilitated learning session so that nurses can think about what they've learned through the course and then be prepared to have a meaningful discussion of what that means in local practice and being able to share ideas about how they would respond if they encountered a situation like the ones that have been highlighted. All of the case studies do not need to be completed during the sessions. Those case studies can be modified for your local practice needs. You may decide to work on a subset of them, and you can also develop additional case studies based on the needs of your learners. So I just wanted to make sure that you don't feel constrained to use those case studies verbatim. You're certainly welcome to tailor them as needed to meet your local needs.
Great, thank you. So we just have a question about the cost of taking the course.
The cost is free, so the cost is it's covered by the Ministry of Health, and there are absolutely no costs to register for the course for any participant in BC or even outside of BC. I know that there's certainly been interest across Canada, and really I've looked to BC as cutting edge and leading the way in this area.
So just actually jumping back to the facilitator guide, how will that be made available?
So we'll have a point person that we'll be working with in each of the health authorities that will be provided all of the materials and resources and communication materials. So you'll be hearing more about that in the coming days.
Good. Thank you for all of your questions so far. I want to just ask for one last round if there's any additional questions that folks want to send our way, and we'll give folks a minute just to think on that, and then we'll move on. Good.
And if you have any initial feedback so far in terms of your impression or anything, any sort of general comments that you'd like to have submitted, feel free to as well.
Question. We'll wrap up the question period at this point in the webinar. And I want to thank folks for your thoughtful questions and your engagement in the webinar and with the development of the course in general. We look forward to continuing to work with each of you to support your teams in having them take the Journey to Perinatal Wellbeing course and in being able to access and draw on the practice support tools that have been made available through this project. As Carolyn mentioned, we'll be sending out an emailed announcement about the course this week that will include detailed registration instructions and will also include information about how to access the facilitator's guide. I want to provide a reminder that the webinar has been recorded, and we'll email the link to the recording out following today's session. This will also be made available on the BC Reproductive Mental Health Program of the Provincial Health Services Authority website if you or any of your colleagues were unable to make the webinar today. So at this point, I'd like to say thank you for taking the time to join us for the webinar today, and please do contact us if you have any additional questions or feedback. And thank you to Carolyn for taking the time to present this morning.
Great. Thanks, everyone, for joining us this morning. We're very excited to launch this practice support online course and resources for public health nurses across the province, and look forward to working with you on the implementation. Have a great day, all.